emergency hospital beds when people have an accident or they have a medical incident, most of the time at night. Finding a place for them to be treated has been difficult. And so there's the emergency center which was built in Burma Camp during the COVID period. We're going to repurpose it so that it has beds for handling only emergencies.
President John Dramani Mahama, as a General Hospital, finally is back on track. Okay, this is the hospital. Nana Addo Dankwa Akufo-Addo, the former president, His Excellency, only the deputy, the vice, Dr. Alhaji Mahmoud Bawumia. Omukobutuguye, AC signboard. So Mbayamala for the former health minister, Dr. Okuboy now how and so free. They never venture it. When they were about to leave office, then they started. And it was about 30, 20, or 40% completed. And Ghanaians said, enough is enough. 8 years of a lot of misery. We are done. Go away. Rain, go away. Go and come another day. Ghanaians want to play. Because come on the yache. After that, and then John Dramani Mahama, only the health minister, Kwabena Mintah Akandoh, who is also one of the hard-working ministers under John Dramani Mahama. He's not the armchair minister in Ibiu. He does not sit in the office, always on the grounds. He visits your hospital without telling you. By the time of when you know you're in the hospital, Edi Papano and John Dramani Mahama, Ekopie wala General Hospital. Now, John Dramani Mahama said after the completing of this new hospital, 160 beds will be added to ease pressure on health facilities. And then he added that the Burma Camp Emergency Center will be refurbished to handle critical cases temporarily, while long-term health infrastructure is completed. Eti Osila General Hospital, no, say, oh, here design, no, here be a hospital, you see, we are the first wire. Beautiful. If you have a leader who cares about health, who cares about the health, the welfare of his people, you understand. And why am I saying this? Forget about the national health insurance for a minute. Today we have the free primary health care. That free primary health care, no, to prevent you from even getting to the hospital for the first place. So something like screening, making sure you know your BP, your are you hypertensive and now you are not, your blood level, your sugar level, all these things that later on causes diabetes, that end up causing some kidney problems and all that stuff, you know. Say 350 free primary care kiosks have been stationed around the country. I better take care of that. Now, after the free primary health care service, the next one is then the health insurance. From the health insurance level, when the sickness is not able to cure, then they send you to what we call Mahama Care. Indeed, Mahama Cares, because some Mahama Care, no, tackle stroke, kidney, liver, cancer, most of the deadly diseases that most of Ghanaians, because of our economic nature, we cannot afford. And health insurance is not to cover that. So if you get to that level, mostly, they never to my and say, you go to the public, beg, then the radio station will like I say, let's do some donation and all blah, blah, blah. By the time the donation is ready, you are dead and gone. And then the money will now be used to bury you. So this is what Mahama Care is solving. Now, after all these beautiful things, the tricycle that was given out, the motorbike that was given out for the rural healthcare systems to be able to also navigate their way throughout villages and go and give that screening. No. The next step for John Dramani Mahama said that 10 hospital where free agenda 111 uncompleted. All the agenda 111 was uncompleted. Now, John Dramani Mahama is promising that will be done. That will be done on earth. So it will be done for me and you. Our healthcare delivery system will be superb. Now, the General Hospital, na ayedin, Ediama, the MPP, so ombetimaya no. Omo na bebutu you for whatever reason. Omo demand complete. When they were leaving office, like 30 or 40% done. Now, John Dramani Mahama and his health minister, Kwabena Mintah Akandoh, is promising Ghana, say, it will be done. Say amen. It will be done. That will be done on earth. This hospital will be done, and the people at La, that will have good health service. You will enjoy better health care. Look at the hospital. Look at after its completion, look at how it is. So if I'm telling that this particular man, His Excellency the President, my president, your president, our president, John Ababio John Kwame Nkrumah, John the joy giver, indeed Mahama cares, and he gives us the hope for a better Ghana. And not just that, the reconstruction of the General Hospital is expected to be completed by November 2027.
Let me congratulate the contractor and the staff for a good job. The hospital is progressing quite well, and we want to make sure that it doesn't stall and that it continues and is delivered on due date. The contractor assures us that by November 2027 we should be able to commission this hospital. Like the minister said, this hospital is important because since it was demolished and was no longer serving patients, all the patients who used to come here now go to the Rich Hospital, or they go to Lekma or to Kolebu. And so it is important that we get this hospital back in a better shape to provide an additional 160 beds. Currently, people complain that when they have emergencies, they are not able to get sufficient beds. So this hospital will add 160 more beds. In the meantime, we have terminated the contract on the police hospital. We're going to re-award it so that we can finish it quickly and then create more bed space. Accra is a fast-growing city, and so the population demands quality healthcare. And so we'll do everything possible to make sure that we complete this project so that we can afford good quality healthcare for our people. In the meantime, we discussed with the minister to see how we can sort out the issue of emergency hospital beds when people have an accident or they have a medical incident. Most of the time at night, finding a place for them to be treated has been difficult. And so there's the emergency center which was built in Burma Camp during the COVID period. We're going to repurpose it so that it has beds for handling only emergencies. And so if there's an emergency and a person is not accepted at any of these hospitals, the emergency center in Burma Camp will be there. The emergency nurses and doctors will be there to stabilize the patient. Once the patient is stabilized, then we can move them to a regular hospital. And so the ministry is taking action to prevent needless deaths due to the no-bed syndrome.
So yes, we have some next year, November 2027, from January of 2027 to November is 11 months, right? And now we are about 4 months gone from our 12 months. So we have about 8 months. In the 8 months plus 11 months, there's about 19 months left. And John Dramani Mahama, someone had 8 years, collapsed a hospital building, and was only able to get to 30% or 40% of the hospital to be completed. Now, the new president comes in power. After a year and 4, I've already started building that hospital. And he's promising Ghanaian an end date. The date that the hospital will be handed over to the people of La. And by November 2027, La General Hospital will be completed, done and dusted, and will be handed over. And when we say an hospital is done and dusted, it means equipment have been placed into the hospital facility. Nurses have been assigned, doctors have been assigned, and it's fully operational. That's when you can talk about completion. And this is what the health minister, Kwabena Mintah Akandoh, and his president, my president and your president and our president, John Dramani Mahama, They are telling us. And when what is our news you are? How do you feel? And knowing very well, sir, an additional of 160 bed will be added into it to make sure, sir, La General Hospital works so well. Now, President Mahama, after say receiving briefing, now October around area the Ecos Biano, the project featured 22 accommodation units, including 11 one-bedroom and 11 two-bedroom apartments, with civil works said to be approximately 70% complete. And this particular part, the bungalows are health workers. And so, etimanya baby, ada. There's no way say osi school krana onsi bungalow, and because the housing crisis, the housing deficit in this country, is also because that when we build government workplace, we don't add resting place or accommodation for them. And the amount of money the other citizens are competing for the same units of housing. John Dramani Mahama is saying that no new hospitals or new classroom blocks will be built without adding accommodation to it or bungalows. Now you say the foreign affairs minister Samuel Kujato Ablakwa out North Tongu ne constituency. When after building the school, he showed the bungalow that have been built. And today we have 11 one-bedroom apartments and 11 two-bedroom apartments with civil work said to be approximately about 70% done. And and this is the kind of assurance we want. When you are bringing the work, let the person get the comfort to be able to work. Maybe I think that this is not enough. Huh? It was 11 there. Say I saw 22 people, health workers in a form, and so we still need more. And we need more of these bungalows. Then, according to the Minister of Health, Kwabena Mintah Akandoh, 60 million Ghana cedis have been paid to the contractor working on La General Hospital. Now, my question is, the former Dr. Kuboy, Sikano near the moment say only see La General Hospital. Did he use all the money? So why is the hospital not completed? Why are we now getting this additional funding? Is it from the same taxpayers' money? And if it's from the same taxpayers' money, is someone answering questions about why we paid for the La General Hospital, but it was not completed? This same Okuboy, and a man of parliament, a friend saying hospital, so only have 20 million Ghana cedis. Yamutu Aira. And he was giving an explanation that you can't even explain. What he was even talking about, I didn't even know. Why? Injoma, why? What wrong have we done to these people? And you and these people, so if you are not arresting them, then all of you are part. La General Hospital, it was awarded. Someone was supposed to complete that hospital. And the hospital is about 40% complete. So at the end of the day, who did we pay the money for? Did we pay all the money? Why are we now spending 16 million Ghana cedis on a La General Hospital again? When we have already paid. When we have already paid. Why? No hala. Time and time will tell. Give time some time and time will tell. The member of parliament for Ladadikotopon, Rita Na Odole Sowa, has expressed her gratitude to John Dramani Mahama for accelerating work on the La General Hospital project after inspecting ongoing progress in the constituency.
Dadekotopon. His Excellency, we are so excited to see you on site today. This project has been on the hearts of the good people of Dadekotopon, and together with the health minister, we fought tirelessly in parliament, and today the project is seeing the light of day. The man that you are, the visionary leader that you are, as you have set foot here today, we know funds will be released to expedite action on the works. The people of La cannot wait to see this project completed. And so on behalf of the good people of La Dadekotopon, the chiefs and everyone, want to say a big thank you to you for having us at heart. We are grateful. God bless you.
You know, say you don't pass finish because 2028 they go vote for you again. Because General Hospital have been a headache. La Daddy go to pon for now complaining, sir. And Nanado didn't mind them. And after say omo mining omo no work was so slow. No wonder Okuboy, Dr. Okuboy, you born a girl away some PVM gotana. He's incompetent. And then the Daddy Kotopon, member of parliament, Rita Na Odole Soa, the excitement on her face tells you about 2028 election. She's so happy. Say, by November 2027, Papa, you be done. John Mahama says, yes, I'll be done. My daughter will say, yeah. Not just say, I do not see, I do not know, and one hunting la. General Hospital will be completed in November 2027. 60 million Ghana cedis have been paid to contractors, and 160 new beds have been added, plus bungalows for health workers to stay in. John Dramani Mahama said this hospital will be ready very soon. Now, my question is, why are we spending 60 million Ghana cedis for a new contractor or for the old contractor? What happened to the previous money? Say that person paid, if he paid all, why was the job not completed? Why are we paying extra money? And why are we not doing anything to anybody? Please help me. Tell me. And Nanado couldn't finish this hospital, even though he was trying to build that Agenda 111. When he collapsed this hospital, not only because his focus was Agenda 111. Today, lo and behold, guess what? John Dramani Mahama, John Ababio, John Kwabena Nkrumah, John the Joy Giver, is giving a hope to a mother Ghana. Now, General Hospital, fast forward, the work that has been done, by November 2027, the job will be done. The entire country is under construction site. For comment to comment section, subscribe, like, let's say more. You know, Max Billian, I will naked truth to Oldboga trends, Accra. Bye bye.